Well, good afternoon. I guess it has occurred to many of you that Pittsburgh is a little bit overly well represented here this afternoon. We began with, there you go, we began with Dan Edmondowitz and just his usual out-of-the-park home run talk about, is there a value in amending risk? And for those of you in the audience who are as old as I am, it's a very interesting thing to think back that it wasn't so long ago, in the 1980s, that the body of thought was, when your number's up, your number's up. And when, and most of what occurs for us is a function of our DNA in this kind of passive view. It's not the case. And I would like to just quickly rifle through some data. I want someone, though, to feel free to assault my person if I speak a third as fast as young Dr. Frank Costa did. The cath lab is a very interesting place. I have spent my career in the cath lab, and so it's a little odd, as Frank suggested, for some of us to kind of step out into this newer domain of alternative therapy. On the other hand, it's a very interesting oxymoron. You know, that the cath lab is where very often vascular disease is encountered in its most naked and rude form. I spent my career in the 1990s working on and publishing papers on how to take care of patients with heart attacks. Many of you remember that in the old days, patients came to the emergency room, they got clot-dissolving medicines, they had a 2% chance of stroke, and they had about a 50% chance of it working. Over the body of time in the 1990s, a variety of studies were published that pointed out there's one way, and only one way, to take care of patients with heart attacks, which is in the cath lab. And one of the odd things that happened was that interventional cardiologists doing these rather hair-raising procedures themselves began to see the yellow eyes of the beast for the first time. So for many of us in the audience, these calamities are abstractions. But when you actually see these acute infarcts, what really occurs at 3 in the morning when you wonder, will you see another springtime sunrise, you have to ask yourself, can't we do better? So risk reduction truly got legs in the 1990s. And it turned out that the reason for the largely negative trials that many of you remember, the Mr. Fit trial, remember multiple risk factor intervention trial was a big negative, was because the intervention was pathetic and feckless. So when you really got serious about lowering risk, you got fabulous results. So the irony is that interventional cardiologists, kind of a procedural-oriented lot, people like here, this is the new GE lab, which is one of these examples of do less and accomplish more. You can image any vascular structure with a 5 French catheter. And so in circumstances like this, acute myocardial infarction, which had a mortality not all that long ago in the 38 to 40% range, now would have a mortality in skilled hands of about 0.4%, with an aggregate hospital cost, adding it all up, doctors, pharmacies, cath lab, IV bags, of about $12,028. So again, do less and accomplish more. And it was in the cath lab during the 1990s that vascular biologists really had a good, hard look at what is the efficacy of risk reduction. We actually opened in 1998, Dr. Maroon and others will remember, a risk reduction clinic as a consequence of these early days of doing these primary angioplasties to see whether or not, with serious rolling up of sleeves and getting on with the business of risk reduction, we could alter the temper of time for these patients, and the answer is a resounding yes. We'll talk about this maybe on a different occasion, but it is the case that, as is said in India, we can change the trends of time, and the argument then would become we have the obligation to do that. So that then led us into the era of stenting. You can see here nicely embedded on a fingernail is a modern stent. And I'll make the argument today that some of the things that Frank talked about and earlier in the day Dr. Maroon talked about, i.e. purely natural products, have a great and natural marriage with techniques such as this. One of those products is Resvertrol. It's interesting to note, see if I get this right, Andy, I did, but the way that stents truly got legs was as follows. On the Easter Islands off the coast of South America, people were digging in the soil about 18 years ago, asking why is it that the trees grow in groups. So as you see here, the deciduous forest, here's the pine trees, and they seem to have this kind of geographical tropism. So the question that somebody was innocently asking was, I wonder why that would be true. And they found in the soil a purely natural product called cerulacin, which is basically they thought might be useful as an antibiotic. It turned out that sirolimus, as it's now described, is what is coating this stent here on the fingertip. And sirolimus is a purely natural product which has entirely changed everything. So rather than killing cells, as was the idea of Frank's laser therapy, kind of charring tissue, in a vascular mode, what's a far more elegant and proper technique is to slow down that G0 to G1. Remember 7th grade biology? That trend of the cell to want to respond to injury. In our short time together, I'm going to make the case that a great deal of human misery is simply the response to injury. And if we cultivate an innocent, safe, and life-supportive environment, it turns out that we don't incur the wrath of God. If we end up having occasion to remodel an artery, we should do it with a certain sense of contrition and apology, and coating these stents with this kind of purely natural product turns out to be an enormous hit. And so this, in a sense, again points out the marriage of two odd ducks here, the interventional cardiologist and the people who more traditionally filled these hallways. And I think that there's actually a great kind of the idea of the reconciliation of what would appear to be opposites. So resveratrol is a product which is so perfectly fitted for this kind of occasion. I'd like to see a show of hands. How many people in the audience are now taking some kind of resveratrol supplement? Could I see a show of hands? Okay. So this is obviously a very savvy and fluent audience. I want to spend our little bit of time together today talking about what is the there of resveratrol. And it turns out that there is a kind of fit here between what resveratrol is and vascular biology that is jaw-dropping. And it all goes back, as actually Dr. Maroon pointed out in a talk he gave at this forum in the fall of last year in Las Vegas, that now 75 years ago, the biologists at Cornell made an improbable but hugely prophetic observation, which is basically that during times of famine, animals don't age.